To the Epilepsy Foundation and the organizers for the opportunity to present today. I'm Viet Nguyen, a medical director in research and development at Biogen. I'm an employee and a shareholder at the company. And today I'm going to introduce our ASO program for KCNT1 related epilepsy. This is a rare monogenic disorder caused by gain of function mutations in the KCNT1 sodium activated potassium channel that helps regulate repolarization and hyperpolarization in both excitatory and inhibitory neurons with limited expression outside of the CNS. These gain of function mutations cause a spectrum of phenotypes, all profoundly affecting quality of life, most commonly and the most severely being the epilepsy of infancy with migrating focal seizures, onset in early infancy with dozens up to hundreds of seizures a day over the first few years of life, and subsequent severe developmental delay and early mortality. There are no effective treatments currently. Almost as severe is an early onset epileptic encephalopathy phenotype, also with onset in early infancy with daily or near daily seizures, including infantile spasms and severe developmental delay. And the least severe, but by no means mild, is the sleep-related hypermotor epilepsy, also known as autosomal dominant nocturnal frontal lobe epilepsy, featuring childhood onset of seizures during sleep, often medically refractory and associated with cognitive impairments. Pathogenic mutations reportedly increase KCNT1 channel currents with no clear correlation at this time between mutation and phenotype. At the AES in Chicago last December, we presented this work in frog oocytes using both previously reported mutations in orange, including one previously reported loss of function mutation in pink in the center of the graph there, that actually showed gain of function twofold over the wild type in our testing, as well as 11 novel pathogenic mutations identified via the Invitae sponsored testing program behind the seizure that we heard about earlier today, for children under the age of 8 who have an unprovoked seizure. Those are shown in teal, and those all consistently show gain of function with currents of multiples over the wild type. Preclinical proof of concept was shown in a mouse model that recapitulates the severe seizures and developmental delay that we see clinically. A single postnatal day 40 or pediatric intracerebral ventricular injection of a mouse ASO designed to silence the mouse version of KCNT1 extended overall survival in the mice in a dose-dependent fashion, seen in the top graph on the top right. Significantly reduced seizures and EEG spikes at all doses, shown in the middle two graphs, and rescued nesting behavior compared with the control ASO, shown on the bottom graph. Similar results were seen with the neonatal postnatal day 2 injection. Our program hypothesizes that ASO-mediated reduction of the human KCNT1 mRNA has the potential to attenuate seizures and mitigate developmental impairments in patients with gain of function mutations. This program is in collaboration with Ionis Pharmaceuticals. Current activities include our Kite natural history study, our preclinical GLP toxicology studies, and first in human global planning, including a straight to pediatric design. The Kite study is Biogen's first fully remote study and is designed to prospectively and longitudinally capture the clinical features of all three main phenotypes and evaluate the feasibility and suitability of assessments in this patient population. The fully remote design leverages a tablet to electronically report seizures and sleep data and provide other caregiver or patient-reported outcomes. Telemedicine visits are used to collect electronic consent, perform the study visits and assessments, including the neuropsychological assessments, and blood and urine samples, vitals, ECG, are all collected via home health service. Neurodiagnostic technologists from the company Neurotech are sent to the home of all these patients to perform overnight video EEG at 3 different time points. There are 40 subjects total. We're following them for 12 months each, and there's a few spots left. We're still recruiting. So if you know any patients, please send them our way. The study design incorporated patient and caregiver input to prioritize their concerns and also their convenience. And the goal was to maximize their participation and participant diversity, the type of people that we could get into this study. as well as input from key medical experts in order to maximize the value to the medical and scientific community and to help inform future clinical trial design. At the AAN Seattle a couple of months ago, I presented some preliminary lessons learned from this study. For example, developmentally delayed kids are hard sticks. So if you send a phlebotomist to their home, there's no charge nurse and there's no backup phlebotomist. So you should plan for that. Also recruiting a diverse group of participants, some of which do not live near urban centers. They have variable levels of tech literacy. So they may not be very familiar with using a tablet to input reported outcomes. In summary, the KCNT1 ASO, in collaboration with Ionis, has the potential to be the first ASO targeted at KCNT1 related epilepsies, a group of disorders that can lead to intractable seizures and severe developmental impairments. The Kite natural history study is the first prospective longitudinal, fully remote natural history study in KCNT1 that will characterize clinical features and investigate clinical trial feasibility. Recruitment is still open, and you can find out more by visiting clinicaltrials.gov and searching for KCNT1, or by emailing KCNT1_study at the University of Rochester. Thank you. I'll take